There are so many people here who live in Chattanooga and the surrounding Tennessee Valley who are avid outdoorsmen. So what do you do when the sport that you love is becoming increasingly difficult? Well, you go to Erlanger Sports Medicine and find Dr. David Bruce. Nice to have you.
Thank you.
We're going to talk about the runners out there, the mountain bikers out there, because you and your practice do a lot of work with an IT band, which is for many people saving their love of their sport. How does the IT band work?
The IT band is a tissue that runs from the hip down to the knee, and it's often involved with friction activity across the knee joint and across the hip, and it can cause pain. It's certainly an overuse problem, and we see that often with our mountain bikers and runners.
So anybody listening to you saying, well, you know, when I run downhill, I'm really struggling. Maybe are they losing their balance a little bit? What's happening if you're having a problem there?
The IT band, particularly when you get about 20 to 30 degrees of flexion, can cause pain about the outer part of the knee, because when you go to heel strike, as you're running downhill, more often you're in that position, so it rubs over the area called the lateral epicondyle, which is where the IT band rubs across the edge of the knee.
So what are you doing? Because it doesn't have to be a surgical fix. There are other ways to address the pain, right?
Oh, most often it's not a surgical fix. Most often it's an alteration in the mechanics, the way they're doing things. Sometimes it's shoe wear. Sometimes it's changing the amount of time that they spend, such as cross-training rather than running all the time or running hills. You can put them on flat surfaces, and certainly get physical therapy involved.